The other clinical tab of the chart houses lists of patient-level data. Data in this tab may not need to be reviewed on a daily basis, but is available for the provider as needed. Some data, such as allergies and special indicators, may also be available elsewhere in the chart. Examples of other clinical data included and organized by category are immunizations, barriers, anesthesia records, surgical records, referrals, and durable medical equipment and implants. The Other Clinical tab contains patient-level information that does not need to be viewed on a daily basis, yet still needs to be available for review. Many of the items in this portion of the chart may also appear as widgets and can be displayed in the Summary tab in Reference Region. Let's review the accordions now. Allergies and adverse reaction data can be entered on the patient through registration, PCS, pharmacy, PCM, surgical, and the patient chart. It can be viewed in this tab of the chart or through the allergy widget. When the accordion is expanded, you can see the name of the allergy or adverse reaction, the severity, status, and date. Selecting an item invokes the Allergy Adverse Reaction Overlay, which is the same overlay you see when accessing allergies through a widget. The overlay partially covers some of the patient demographic data, so the header of this screen displays the patient's age, sex, date of birth, in addition to the patient's current allergies and adverse reactions. Tap or click anywhere outside of the overlay to bring you back to the tab. When you expand the Blood Bank Summary accordion, you see it is broken out into the subpanels of Blood Bank History Report, Blood Bank Summary, Related Tests, Transfusions, and Reports. This panel can be toggled to show selected visits or all visits, depending on your needs. If you are looking to see your patient's history of blood bank data, selecting Show All Visits would provide you with past test results. All of the information in this accordion is also available in the Blood Product Summary widget. The Care Team accordion shows the patient's providers for their current visit. Selecting the Edit button will allow you to make any necessary updates to the providers. The Codes accordion displays any diagnosis and procedure codes documented on the patient. The name, code, last date of documentation, and number of visits display on the screen. This tab displays health maintenance and substance abuse data. Health maintenance includes history queries and relevant lab tests and reports. The substance section houses substance abuse data related to your patient, such as history of smoking or alcohol consumption. This data is also available through the Health Maintenance widget. You can use this data to gather a history of your patient's health. The Immunizations accordion displays the immunization and data administered for the patient. Here, we see Lucy received an influenza vaccine on September 4th of 2017 and a Tdap vaccine on May 29th of 2018. Immunizations administered in the Expanse system will display here. Historical immunizations can also be added to the patient chart by selecting the Edit button. The Medical Summary accordion provides you with inbound and outbound messages regarding the patient's care. This provides you with the ability to see any external reports coming from an outside system, and likewise, see any messages sent out to an external facility. The Order List accordion is comprised of current and complete orders across the acute and ambulatory care settings. In this accordion, you can see current orders that may possibly affect the patient's care. You can gather a history of orders placed on your patient for all visits. If the patient has been given patient education handouts specific to a condition or treatment plan, you can expand this accordion to view that data here. The name of the education, the provider responsible for associating it to the patient, and the data are available. Hovering the mouse over the eye icon displays additional information about the education. If the patient's preferred pharmacy has been recorded in the EHR, you can view the data in this accordion. This is useful for ambulatory physicians placing home medications on their patients and for acute providers preparing prescriptions for a patient that will soon be discharged. The Personal Notes accordion allows you to add, review, or update any personal notes for this patient. These notes are specific to the signed-on provider and not stored as part of the patient's medical record. To see any referrals or authorizations associated to your patient's medical record, expand this accordion. This is beneficial to see any specialist your patient has been referred to by you or another provider, as well as to see any necessary authorizations for specific patient care. Special indicators are used throughout the system to attach a flag of importance to a patient who may have special conditions, such as fall risk or MRSA. Special indicators are attached to the patient during the registration process. The Surgeries accordion allows you to view any surgeries the patient had on their current or prior visit. Select the Implantable and Surgical Devices tab to see any devices the patient may have. In Lucy's case, she does not have any implanted or explanted devices. The Workload Items accordion displays any notifications you are set up to receive on your patients, such as the immunization, registration, and admission notifications we see for Lucy. Documented patient healthcare goals, as well as barriers that may prevent the patient from reaching their healthcare goals, such as inactivity and unhealthy lifestyle options or disease, display here. Any letters generated for the patient, for example this letter indicating the referral order for Lucy, will display in the Letters accordion. The Forms accordion will display any forms that have been generated for the patient, such as a work or school release form. Patient-generated data displays any questionnaires filled out by the patient, for example a questionnaire about their medical history. This concludes our overview of the Other Clinical tab. Next, we will review the Diagnostics tab of the chart.